So I'm going to talk to you about workforce race equality in Greater Manchester. I'm going to talk to you about why I'm talking about it and why it's important, how we do what we do in Greater Manchester and what we do. And I'm going to underpin it with stories, with lived experience, with real lived experience. So with that in mind, and I'm going to read this out for those people who are just using sound and not vision. Isn't it important that we listen to people, especially people who help others, who are there when people are in need, who see the worst and hope for the best for everyone? Isn't it important that we should want to be in others' shoes, to know what it's like and how we can be our very best? Isn't it important that we don't just help the strong become stronger, that we don't just have space for one woman, one BAME, one person who is different at a time? Isn't it important enough to do something that matters, something that makes a difference to what it's like to just be who you are? That's a real story and it's a real piece of text. Not written by me, but by one of our staff members in the public service system. My story, I grew up on the street in the top left-hand corner. And I was the little kid in This Is England. If people have ever watched that film, I find it quite difficult to watch. So as that little kid growing up in a working class estate, I saw some great things. A lot of my friends were a lot older than me. But because they were a lot older, I also saw things I probably shouldn't have seen as a youngster. And that's why I'm passionate about this work. The National Front were very operational in the 80s. And very operational in Salford. And so I saw things, but what saved me from that was the social capital that I had from my dad. It was my dad, and it was the background that he gave me that enabled me to see that that was wrong and that it was that social justice was really important for everyone. And it's important to remember there'll be a lot of people, white people like myself on the call today. We've all got a culture. So culture is not just for people of colour. It's not just for racially diverse people. We might be the dominant culture. We've got a culture. We need to connect with that in order to connect with others. So I'm going to talk about the head, the hands and the heart. So here we go. This is why we do this work. There are 5 reasons that workforce race equality is absolutely critical in the work that you guys are doing across your organisations. The obvious ones are the legal imperative that you have, and I'm going to take it that we all ethically believe it's the right thing to do. Now, you may not, and you may want to have a debate about that, and that might be something for another time. Some people don't believe in it, and having conversations about the ethics of this is critical. Conversations about it, that we're able to talk to each other about this work. But there are studies proving that your organisations do better financially and quality-wise when they are inclusive, particularly when they're inclusive around race. So it's a no-brainer. If you want to deliver a good service, then you need a good, inclusive, representative workforce. And my final piece is that there's an economic reason for this as well. In Greater Manchester, we have the second biggest economy in the country. It's why we got devolved. It was the Manchester Independent Economic Review that showed that actually, as a solid system of 10 local authority places, we had a defined economy and it was large, and we weren't making the most of it. And as organizations out there, you have jobs to offer people. You have really good jobs, vocations, and we know that good work not only leads to good economic outcomes, but also good well-being outcomes, as Sheni has pointed out. So actually being inclusive and offering good jobs to people in our communities who we serve is going to have a demonstrable impact on the outcomes in the economy of the people in those places we serve. So this is why we don't make the best of our population in Greater Manchester. It's because we consistently have numbers of people on long-term sick and numbers of people unemployed. And if I was to draw a line, and, you know, Wythenshawe is in there, so don't get me wrong, if I draw this line, there aren't no deprived areas, but actually most of our wealth sits within that area of Greater Manchester. And a lot of our racially diverse communities sit in the north of the conurbation and in Manchester itself. So being mindful about the equalities that play out, and as Joe talked about at the very top, population health. Well, if we're going to deal with population health, we have to deal as well with the how we employ our workforce, who we employ and who we provide opportunities for. And no more has this come up than through Black Lives Matter. And the reason it's come up is because of statistics like these. So this is the data. This is the stuff that tells you why we have to do this. That you are 9 times more likely as a Black person to be stopped and searched. And I know this is slightly old, but it's not changed too much, sorry. Than if you're coming from a white background. You are far more likely to be stopped and searched by the police. You are 5 times more likely, I think it may have dropped to 4 times now, very recently. This is a study that's about a year old. 5 times more likely as a Black woman to actually die in childbirth than a white woman. Let that just sink in for a moment. Just think about that. That is not right. And we can't say that this is about genetics, because it's not. It's, you know, it's about the way we deliver services and the way that people access services. So what are we doing in Greater Manchester around workforce race equality? This is the stuff that we're doing. We have signed up as a collective to tackle workforce race equality. We've signed up together to address it. And when I say as a collective, I mean whole public service. This isn't a workforce race equality standard piece of work that the NHS does. This is about the NHS, police, fire, the ambulance service, local authorities, transport, and the voluntary sector coming together and saying this isn't good enough, and we all have collective issues. And we employ 1 in 9 people in Greater Manchester, and it drops dramatically if I talk about working age people. That's 1 in 9 of the 2.8 million. We employ a lot of people, and we can have such an impact on this if we, you know, make sure that employment is fair and equitable. So we're doing 5 things, which I am going to talk through. So we're doing a piece of work on data across public services. The NHS already captures the workforce race equality standard, and you will notice in those 3 measures, if you're working in the NHS, that those 3 are ones that are captured in the NHS regularly. Distribution according to pay, the likelihood of being appointed at interview, and the likelihood of being subject to a formal disciplinary. We know there are disparities in these areas, and that's why we've chosen to focus on them in the data. And what we've attempted to do is start to get that data across all of our public services, which is challenging because police and local authorities do not capture all of that data in the way that the NHS does. This is our Greater Manchester NHS split that we have got at the moment. It tells a story. I could dig into it and tell more stories, but it tells you there's a glass ceiling at band 5. And you will know these things if you've looked at this. It tells you that non-consultant career grade doctors are by far in excess of consultant career grade, you know, consultants in terms of representation from racially diverse groups. And it tells you that, you know, we have a drop off in senior grades. So there's no great surprise there. If we look at the police, interestingly, we've also got similar distribution. The police did a big recruitment drive in the last 4 years to try and attract more racially diverse groups into their organisation. And you can see it in the early constable grades here. They're starting to get some representation. And then there's a massive drop off again, where they haven't done that recruitment. So they're working on it. But what these figures do is begin to tell us a story about where representation exists in our organisations. And what we found, generally speaking, is that 3/4 of the organisations who provided a return to us, health, local authority, police, fire, etc., reported that you were over 1.24 times more likely to get a job interview if you were white. So we've still got an issue. And that 4 of those reported are twice more likely, and 2 of those reported 3 times more likely. So we've got some issues. Can't hide from it. It's the majority here. And the same happens around the likelihood of being subject to a formal disciplinary. Nearly 3/4 again is biased towards white people being less likely to be subject to a formal disciplinary than black people. So again, this is about building a place for everyone. And that is everyone but, and this is people's experience, but black people, but immigrants, but the underclass, but people we don't like the views of, but people who wear trackies. Storytelling is really important alongside data. It's not enough to tell data. People's lived experience is critical. These are pictures from the People's History Museum in Manchester, just on the River Irwell in town. And this is about us trying to link the story of Manchester and Greater Manchester to the story and the fight for equality that we're trying to do now. And connecting people to stories is critical. And we are doing work in that. We're doing live conversation pieces with people from racially diverse groups about their experiences of working in public services and broadcasting them, trying to get that story out to connect people to the story. So the action we're taking. 2018, we made a pledge as organisations across Greater Manchester to tackle workforce race equality collectively. And then we said we would do a number of things, 3 things in terms of action. We've got a race equality change agents programme. We've recruited frontline, first line and middle managers to that programme to develop them as champions of race equality in terms of awareness around equality and diversity issues, and also awareness around change methodology. This is similar to the Res Experts program that people will be aware of, but it's a bit more developed because we go into change methodology and QI methodology. We do a 6-month program with people, and then they have a 6-month project that they work on with a coach in their organization to create change in their organization around race equality. It may be small, it may be about how they advertise posts or how they recruit, how they interview, but then they do that change program and then look at the changes that may have had impacted, and then they share that with the group. And we're beginning to now build a bank of people who've done stuff and what stuff has worked for them. We're running a Building Leadership for Inclusion program with senior leaders. This is assistant chief constables, assistant chief fire officers, directors of workforce and strategy, and deputy chief execs in the NHS and in local government. It's an 8-month program. We've done 6, or we will have done 6 sessions of direct learning and 6 action learning sets, place-based action learning sets. These are action learning sets focused on the places that those people serve. Our theory is, if you've got an assistant chief constable, an assistant chief fire officer, a director of strategy in an NHS trust, and a deputy chief exec in a local authority, what could you do collectively for Stockport or for Wigan or for Bury? You've done this learning, but what could you do collectively as really senior leaders? You can do stuff in your organisation, but what could you do together? And we're beginning to see the germs of some really interesting work. We're about 2/3 of the way through this programme at the moment. Shenny and I are delivering it along with Eden Charles. And then we've got a reverse mentoring program that the Northern Carolines are delivering, where we're really trying to link people up with lived experience. So senior leaders with experience, with lived experience through reverse mentoring, but also a mentoring program for our colleagues, our racially diverse colleagues who don't always get access to mentoring opportunities. Gives them an opportunity to get to know people and connections, because relationships is often where you make your way through your career. I think this one really sums it up. This is why we're doing this work. And, if I talk to a group, sometimes they will say this to me: I am tired, I am exhausted, I have heard this before. Where is the accountability? Where are people being held to account for this? And if change doesn't take place and everything remains the same, it's just exhausting. Can we have action? Can it not just be a tick box exercise? Can I see change? We've talked about this for a long time. And the one thing I didn't say at the start is the reason we chose race is because demonstrably over the last 40 years, a lot of the outcomes for people of colour have not changed. We might believe they have, but despite all of the social change around us, they have not changed. They have changed in other groups, but far less for racially diverse groups. And I just wanted to finish with the man. So, you know, no one is born hating another person. This is a social construct that we have created. And, you know, it's something we need to challenge within ourselves and within our colleagues, and have some confidence in the conversations that we have with each other about this, and be open to talking about race equality in the future.